Welcome friends. I am Dr. Baldev Prajapati, Professor Emeritus and Director, Medical Education and Research, Baldev Medical College and Hospital Kadi, located in North Gujarat. These are my 4 books published in the field of pediatrics, particularly on procedures, signs and symptoms, clinical pediatrics, and very specific on OSCE, spotters, and viva. Friends, I am going to talk on edema today. Please remember how the edema is defined. Edema is an excessive accumulation of fluid in the interstitial space or the serous cavities. Edema can be either localized or generalized. Localized edema, that is swelling, may be due to insect bite and some pressure effect like tourniquet or tight bandages. Urticaria, cellulitis, and angiolytic edema are other causes for localized edema. Generalized edema may present as puffy face, swollen eyelids, swelling over face, feet, and ascites. Sometimes excessive weight gain, especially in the neonates, or tight fitting of the clothes in young children or shoes, and feeling of the discomfort by older children may be the indicators of development of edema. Let us see how we can evaluate. Go in the details of onset, site, and progression. Acute onset, sudden onset may be in a case of insect bite, angiolytic edema, allergic edema, or even the acute glomerulonephritis. But insidious onset in a case of nephrotic syndrome, sometimes even hepatic cause, because in hepatic region there is the decrease in the albumin, and half-life of albumin is almost 21 days. Therefore, it takes more time to develop the edema due to the hepatic cause. Periorbital edema indicates fluid collection starts in the periorbital region due to the subcutaneous tissues and the fat. Most common it is renal origin, but sometimes acute conditions like angiolytic edema and iatrogenic even excessive IV fluid may indicate this puffiness of the eyes. Morning edema is commonly of renal origin, and it develops due to the gravitational factors during the sleep. Friends, remember the bilateral pedal edema in less than 5 years is most common due to the severe acute malnutrition. Maybe even in a case of the congestive cardiac failure due to the venous stasis. And ascites is the characteristic of hypoalbuminemia due to early liver disorder. Please, in the examination, try to define whether is it pitting or non-pitting. And for examination, press over the skin of the tibia or above the medial malleolus as it is shown in the picture for 30 seconds. Please check, keep in mind for 30 seconds. And development of pit or depression indicates the pitting edema, which is shown in the picture, while on the right side the picture shows the non-pitting edema. Now, the non-pitting edema may be in a case of filariasis, lymphangiectasia, lymphatic obstruction, or Turner syndrome with presence with the short female pretibial non-pitting edema even in the neonatal period. Noonan syndrome is having all the features like Turner, but in the male child, and therefore it is called as the male Turner. Hypothyroidism again is a condition present with non-pitting edema. Bilateral or unilateral edema is also very important. commonly bilateral due to the cardiac cause, CF pericarditis, renal due to the nephrotic syndrome or acute glomerulonephritis, hepatic due to the cirrhosis of liver or portal hypertension, mixed edema, angiogenetic edema, kwashiorkor, that is severe acute malnutrition, epidemic dropsy, they present with the bilateral edema. Unilateral edema may be the filariasis, cellulitis, deep vein thrombosis or fracture of the bones. If it is generalized edema, commonly it happens to the increased hydrostatic pressure in a case of congestive heart failure and acute glomerulonephritis. In some conditions, there is increased capillary permeability leading to leaking of the fluid and results in edema like dengue fever, allergic edema, henoch purpura, SLE, Kawasaki disease. Decreased oncotic pressure, that means low protein, particularly the albumin, happens in a case of nutrition like severe acute malnutrition or kwashiorkor. Decreased synthesis of protein, that means hepatic cause, cirrhosis of liver, or there is loss of protein, that is if it loss is from the GI tract with malformation, maybe the celiac disease, inflammatory bowel disease, or even tuberculosis and HIV like infections. Nephrotic syndrome is another condition where there is loss of the protein in urine. Thank you very much, friends. Friends, before I end, I request you to subscribe over this channel, and if you subscribe every time, you will get some new informations very useful in the exams and in the daily practice. Thank you. Thanks a lot.